Okay, these are just a few questions that people didn't want to ask publicly,
Sure.
but they apply pretty much to everyone on the panel. Okay, the first one is, will Aviano turn me away if I haven't registered with them and I am in labor?
No American medical facility is going to turn you away. I don't think the Italians will either if you walk in with an urgent condition. Please do not drive up to Aviano if you're in active labor to try to make it to the Air Force facility unless you want your husband delivering a baby north of Venice on the autostrada. So that is very bad medicine. I understand everyone has a very different situation. I think that, again, there is still a lot of the unknown out there with, I just don't know if I want to deliver downtown, but I can't spend 3 weeks away from the family. Boy, the closer you get to 40 weeks driving around in a car and anything can happen, I would not put my family in that situation. So if you show up to Aviano, they're going to take care of you. Unless you've got a copy of your medical records, they're probably not going to know what's been going on with you. You're not going to know the providers that are up there taking care of you. Although it's American, it's just really not a good way to do it. So I would highly recommend that you not do that. There may be some potential to have discussions with the providers at Aviano, depending on first pregnancy, second or more pregnancies. When did you deliver your first baby? Did you go post dates for the other two? Or do you always deliver at 38 weeks? You know, those kinds of things we can help work through with the providers up there at Aviano. But showing up cold on somebody's doorstep is really not a good way to receive medical care, and probably not the safest way to bring your baby into the world.
Okay, our next question is, at San Bortolo, can we sign an against medical advice form to shorten our recovery stay or to opt out of certain procedures?
You never have to have a medical procedure that you don't sign consent for, so they are not going to force you into procedures. I would tell you when we delivered in Ansbach, Anne was in the hospital for 5 days, and she loved it because she actually got to, rest and relax. The American standard for vaginal deliveries is usually 48 hours in the hospital, and for a C-section it's 72 hours. In the Italian hospital, it's probably 3 to 5 days for the first and 5 to 7 days for the second. Again, knowing that we Americans expect to be out of the hospital a little sooner than our Italian moms, I think the providers work with you pretty well to try to figure out when you're medically stable and when you can go. Obviously, this is an issue probably more so for moms that have a couple of their kids at home and really need to get back home. But again, just have those conversations with your provider, have those conversations with Dr. Novak. It shouldn't be a case where you have to sign out AMA. If they're keeping you there, it's usually for a good reason. And a 3-day stay for recovering from a delivery is probably a good thing. So just bring that up with your provider.
This one's more for our moms, Katie and Laura, who have delivered at San Bortolo. Will San Bortolo accept and use our birth plan that we write out? Is that a good idea? And will they have a handout or check sheet that the clinic offers and utilizes now? Yep. Will San Bortolo accept and use a birth plan? And do they have a checklist that the clinic utilizes now? I'm not sure what checklist, but...
When you meet with your OBGYN at San Bortolo, one of the things that they ask you, and this was the most important thing, I think, of every appointment that I've ever been to, they said to me, what do you need to do to make yourself happy here? What do we need to do? How can we facilitate you? That's the point where you lay out your plan with them. If you know you want to have a water birth, okay, they have water tubs there for you to have a water birth. If you know that you want an epidural, that's the time to tell them. If you know, like in my case, that I wanted my mother there, who was going to be here from the States, and we know that's not a norm here to have random people just hanging out in the delivery room. So anything that you want specifically, that's your time. And that is when they will sit down with the liaison. They'll make sure that they understand everything that you're trying to say, everything that's important. And if they don't really understand it, they'll try to find out if it's acceptable. If you have a plan and you know that's the way you want to go, just stick to it. And even if they maybe try to say, well, we do it this way, this is what I want, this is what I need to do, and they will do their best to accommodate you at that point.
In my situation, I brought a birth plan, in a manila envelope, and it came in very handy because my son was born in July, and it was our fan. So yes, they did use our birth plan. Just kidding. We did do that though. Yes, my birth plan was it was really useful, and they were very accommodating. I had a couple requests in my birth plan that were sort of out of the ordinary, and they went out of their way to fulfill my requests. And my situation was that I showed up there when I was ready to have my baby, so I didn't labor there at all, so I can't speak to that. But the requests that I had were a delayed cord clamping, and I hadn't spoken to anybody about that beforehand. So I wasn't sure if they were going to accommodate that or not, and they were no questions asked. And I know that some American doctors, there's controversy surrounding that, whether they would do that or not, and they didn't question me at all. So that was part of my birth plan that they didn't have any problem with. And the other one I had was sort of strange, but I had my best friend's sister was in town, and she's a doula, and she was really interested in my placenta. And so I asked them if I could take my placenta home, and they said, yeah, sure, why not? And they didn't question me at all, and that was part of my birth plan. And I thought that was really cool. So they were very accommodating to my birth plan. So I thought that was really special for me. So yes, and yes. They didn't have a checklist. I don't know what the checklist is about. I didn't have any checklist. But also it was my second child, so I didn't have, my birth plan wasn't 5 pages long. It was just a few things.
The other thing I'll ask you to do is, as you're making those birth plans, as we get closer to transition, we'll have a system in place where we can take a copy of that, and we're going to try to get that translated for you by the patient liaison. I think that'll be really helpful, so you can walk in and basically hand them an Italian document of what your expectations are. That might make that a little bit easier. So we got that plan too.
Mm-hmm. Okay. This is to Laura and Katie again. For those with experience as patients at San Bortolo, what tips do you have for making our experience better?
That, once again, is just going to go to communication. You have to know what you want if they're not mind readers, and you're so panicked at that point, you know, when you get there, especially if it's your first child, you're nervous, you're scared. So have everything really laid out. If you know that there's something that's a little not out of, you know, the norm, I would say have someone translate something for you so it's written down. A big one for me was, other than having my mother there, I wanted my husband not just to be in the delivery room with me, I wanted him to stay there with me. And I had been hospitalized previously on the ward, the main ward, and he was not allowed to visit me but 2 hours a day because that was the standard when I was on the ward. So one of the things that they did for me was they put me in a private room on the 6th floor. That way my husband not only could stay with me during the day, but he could sleep there. And that was at no extra charge, no cost to me and my family. But it gave me the comfort I was so worried about. I was going to be there. I was going to be with all these other women that I didn't know, that I didn't speak, you know, their language, and I couldn't see anyone that spoke English for, you know, maybe the whole day. These were things that really genuinely scared me. And being the social person I am, having him there, having my friends be able to come in and out of my room as they wanted to, having them not take my baby away, you know, and take him into the nursery, these were things that I wanted, and they accommodated me so graciously. The nurses on the 6th floor, most of them speak English, so anything I needed or wanted was very easy to communicate. And of course, having my husband run errands for me as I needed was a little bonus.
I've got something I can stretch you on that too. I didn't actually deliver my baby at San Bortolo. I delivered here on post, and then as she was being discharged, she had to be transferred to the NICU at San Bortolo. So one of the things that I can say in regards to that as, first of all, if this is a concern that you have, the medical care that you will receive is what it should be. I'm a nurse, and possibly nobody is more scrutinizing of medical care that they receive as a patient as a nurse is. And so I was analyzing every little thing that was done. So I do feel medically we were taken care of. Anything that might be classified as perceived as negative or anxiety causing about our experience at San Bortolo is largely related to the culture clash that we're all very aware of. So in regards to that, just to reiterate what we've heard so far is be ready to communicate and advocate for yourselves. If you want to be extra proactive about it, I would write down some Italian phrases, carry a little cheat sheet around with you, anything that you potentially might think of to say during your labor, have those things handy. And the reason I can speak to how useful that is because over the course of my daughter's 5-day stay in the NICU, there were many times during that time where the patient liaison was with someone in the emergency room or some other patient of higher acuity, and so we were left to our own devices to communicate. There were a couple of physicians in the NICU who speak English, and some of the nurses spoke about as much English as I speak Italian, which I'm glad to say was enough to get us through those afternoons where we didn't see a liaison at all. And that did happen. So I don't know if that's something perhaps as patients are discharged, perhaps they can be surveyed as to how many times they were found without a liaison at their disposal, and that could maybe determine if there is a higher need for personnel to be here. With regards to the list of Italian phrases, maybe that could be included in the book that's being produced by the clinic, some high frequency phrases that come up a lot during labor and delivery that patients could refer to. So I would just say that that's a useful thing to help you feel like you're communicating your needs and your concerns. If you have questions about your care, if you have concerns about your care, don't let your anxiety about the circumstances overwhelm you. Don't let the unavailability of a liaison let your problems not get discussed. Be resolute and be ready to advocate for yourself. Keep notes if you need to along your stay, and don't let things not get addressed, because that's a great way to have a bad experience. So just be really ready to facilitate your own care, and don't get nervous about it. Don't get anxious. Now that's easy to say. Even with my own philosophy of this, there were times during my daughter's hospital stay where we got overwhelmed, and we had a bad experience with something that day, and when those days happened, it's when we sort of lost focus of, it's easy to get overwhelmed in having your child in the hospital or having things not go smoothly with your own labor. You can get overwhelmed. It happens. But just try to keep as level ahead as you can and deal with any crisis that might come up. But really be diligent about maintaining communication. Don't let the language barrier get in your way. I mean, it's going to happen at some point, I guarantee it. But don't let it overcome and dictate your stay. Any bad memories that I have of our time in the hospital wasn't centered on the medical care. It was really centered on, in my case, the visiting hours. We did not have the access to my baby in the NICU that we are used to in American NICUs. They were pretty stiff sticklers to the visiting hours in the NICU. My husband could only see her at their established visiting hours. There was no negotiating that. But what I did was I found out their policy on it, and I took it to the liaison and discussed it with her, and I said, this is what I've come to expect working in a NICU, being, personally, I worked in a NICU, and being an American patient, this is what I'm used to. Is there a way we can accommodate and reconcile the reality in this facility with what I've come to expect? And by doing that, we were able to establish times that were agreed upon in advance with the nursing staff where I could come breastfeed, which was a huge concern for me, establishing a good breastfeeding routine. So by pushing that issue and making sure it got addressed through the liaison, who is a resource that you need to take advantage of, we were able to establish times with the nursing staff where I could come and have that time with my baby. It wasn't exactly still what I 100% wanted, but it was better than what we would have gotten had we not asked. So we were able to have some additional time where I was able to come in and be with the baby outside of the regular visiting hours. Now, if any of you end up in the NICU, I was told by 2 nurses that they're trying to extend parental visiting hours in the NICU to 24 hours. I don't know what the hospital's process is for making that a reality. I don't know how far they are in that process, but I was told it's being addressed, and like Colonel Barr said, hopefully it's one of the things that they're trying to normalize more with what, reconcile what we expect and what they in reality provide at the hospital. So I hope none of you end up in the NICU, but if you do, I'd be happy to speak with you more about my experience too. But generally speaking, communicate like the Dickens. Don't let it fall apart.
So, some things that I would suggest to make your stay more comfortable is just to make sure that you educate yourself on what to expect. Things like this, going on the tour, which is, I didn't have that available to me. When I was preparing my choice, this was my second child, and my first child was born on base, ironically. And my second child, I was making the choice whether to have another C-section or not, and my only option was to go downtown if I didn't want to have one. So I was really having a hard decision and trying to educate myself. I went downtown, went down to San Bortolo, asking for a tour, and they wouldn't allow me to tour the facilities. So I was having a hard time. So doing things like this, going downtown, but the supplies that you have to take with you are a lot different than the supplies that you would need if you were in the American facility. So making sure that you pack your bag appropriately will make sure that you're much more comfortable than if you don't. So the packing list is really, really important, and educating yourself, and also just changing your mindset a little bit about the cultural expectations will make all the difference. So I know that we all expect a lot of things, but making that adjustment in your mind will make a really, really big difference. I never was in a situation where I needed someone to translate something when there wasn't anyone around, and I just made the phone call to the liaison, and she was always there. So just changing your mindset a little bit will make you much more comfortable, in my opinion.
Just real quick, just on a couple of these things. We talked about the private rooms a little bit. So San Bortolo is well aware that those are things that we want and expect. And so as long as you're stable and baby is stable and they have room up there, the expectation is that you'll be up in a private room. If that's not where things are going, again, just please ask for that. One of the other things that came out of our early conversations was if we can't get up to the private room, actually cordoning off a couple of rooms where there'll be American patients only, so a double room instead of a quad room, and there would be another American mom in there with you, so you have somebody to talk to and that kind of thing. And then the packing list and a couple of the other things that we've already taken back, those will be in the baby handbook as well when we publish that, so it was a good idea.
Okay, our next question is on post-baby care, like what materials you're given, medicine after you have a baby at San Bortolo. I know at the clinic we were given just different things that I had a baby at the clinic too. Like, so what do they do the same like stitches, the mesh underwear that they give you at the clinic? Like, how is that there?
So postpartum for the mom or the baby?
The mom.
Let's see. So the stitches, yes. Postpartum underwear, no. So that's part of the packing list. That's a major adjustment. If you weren't aware of that, that's something that you'll have to have someone bring you, or they'll give you something that you're not used to. So that's part of the crucial packing list that will make you much more comfortable.
Creams was on there too. Like, do they provide?
Like breastfeeding cream? Or
Yeah, I think that's what she.
No, I didn't get anything like that. Tylenol, they gave me Tylenol, but I was in a lot of pain, so I phoned my doctor, and my doctor put in something a little more than Tylenol. My husband was able to pick it up at the pharmacy that day, and he was able to bring that up to me. And as far as the visiting hours are concerned, they were strict on the visiting hours because I wasn't in a private room. I was in a shared room with one other person, but there was also a lobby area on the floor, and they told me that my husband could come up and bring things to me, like food or supplies or something like that, and I could wheel, in the little bassinet, I could bring my son with me out to the lobby, and we could sit and visit, and we would sometimes sit there for 30 minutes and visit, and I could bring the baby with me, and so I wasn't in total isolation all day long. And I noticed that I was the only one doing that. No one else was doing that. And in the area that I was at, there was a small refrigerator too. And they told me that if I wanted to bring snacks or something that needed to be refrigerated, like leftovers, which we did, I could just label it and put it in the refrigerator. And I was also the only one doing that. I only stayed for two nights, the night that I delivered and the 2 nights, and then I was released the next day by noon. And my husband came every day, and we visited always for, in the lobby for like 30 minutes, maybe twice a day or something. And he always would bring me things and take things away that I was done with, and he brought food and stuff. And he visited with my newborn son. So the visiting hours were at night when he could come into the room for an hour with my other child, and then the baby for the second hour went back into the nursery. So I didn't feel like I was in total seclusion from him. We were able to visit in the lobby area. As far as baby supplies go, they provided me with diapers, but I brought my own because I didn't know what to expect, and I also brought my own wipes. And then the nurse came in and saw me wiping him with wipes, and she said, no, we don't do that here, put those away. And she encouraged me to rinse his bottom in the sink. And I did that because that's what they told me that it was the best thing to do, and so I sort of wanted to follow the rules. So I just rinsed his bottom in the sink, and there was soap in the bathroom, and I used the soap for his bottom. And there was hand soap in the bathroom. There was no towels. They gave me towels to dry him, but towels for myself, there were none. But they did provide diapers for him.
One thing, if you've had children before in, let's say, the States, example, and you are used to going to the hospital, they give you a gown to deliver in. That doesn't happen here.
No.
So if you're going to have a gown with you, prepare yourself to give birth in that gown.
Yeah.
So that means no pajama pants. If you're bringing pajamas thinking to yourself, oh, I'm going to wear this at the hospital, isn't it a nice, cute set? Well, be prepared to not have the pants on because they expect you to have a gown that you brought yourself. That was different. Like she said, the no wipes. Also, they didn't provide an outfit for your child, which in the States, usually they have a little t-shirt or a little gown that they give you when your child is born. So I had a really cute little outfit for my son to wear home, which he actually ended up almost wearing the first day, except he was too big for it. So my child was the nude child. So that was rectified pretty quickly. Other than that, the diapers they did provide. They did provide us with a cream if you want. Like she said, underwear, you're going to need those because they're not going to give you any type of, like in the States, it's usually like a garter belt system, which they don't do here. The other thing is they don't use pads here. It was a different type of like the things that you lay on your bed, kind of folded up.
Yeah,
so
it was a sheet.
Yeah, so it's kind of weird, but if you want to bring your own pads with you to the hospital, they will let you use those. So that might be something you might want to consider because that was awkward for me.
I would encourage it.
Definitely.
When my daughter was in the NICU, they were putting 3 and 4 outfits on those kids to keep them warm enough. So for goodness sake, don't let your little one be naked and chilly. Ask them if they can please get someone at the intensive care unit to bring down an outfit for the baby to wear. I don't think they would deprive you that if you asked for it desperately. They may not do it as a standard, but they've got it there somewhere if you really needed it.
We didn't bring socks because it was July and they brought us some socks. They insisted we put socks on him. It's July.
We talked just a little bit about visiting hours. That is another thing that we're addressing with San Bortolo. So again, that's another thing that it's a kind of an Italian standard, and American standards are quite a bit more loose, and especially in a NICU environment, being able to come and go as you need to. So those are things we're addressing for the future.
Okay, if we only have a month left here when the baby is born, will we be able to get his passport in time to move back to the States? I guess that would be a better question for Ed.
I can actually answer that. We had the unfortunate incident of having to go on emergency leave 3 weeks after my son was born. We did not have a passport yet. Actually, we hadn't even applied for the passport yet because it was actually right before the 3 weeks, and we were still waiting on the birth certificate. We were very fortunate that we found out that Milan has a passport agency there, and you can get an emergency passport in less than 24 hours.
Oh, that's
So
awesome.
I'm sure that if they know you're moving, they're not going to make you leave your child here. They're gonna help you out. And it just took a trip down there. I mean, it was an afternoon. Everyone here at the passport agency helped us out incredibly. They got everything we needed together, and 24 hours later, I was able to get on a flight and attend my brother's funeral in the States. So.
Okay, what if you move in between applying for your tourist passport and getting that and applying for your social security number and no fee? Would you just end up getting that in the States?
First, it was the tourist passport, which takes, a certain amount of time. We still do not have my son's social security number, but that's because we were held up a little bit by the emergency passport. When the emergency passport was applied for, they actually pulled our application for the tourist passport because they could only have one going on at a time. So we've now received that passport. My son just turned 4 months, so we now have his tourist passport, the official one. And also should have his social security number within the next week or so, they said. So was that?
Sorry, just in regards to that leave, if it's like a PCS leave or something, I specifically talked to my S1 about it with other regards to other soldiers in my unit and whatnot. There's a curtailment that you can do. You just look for it. It's a 4186 FST curtailment. And you can push your family and have them going back to the States sooner than you. If it's a part of your PCS, if you're hitting that time block where you might be here and your paperwork might not be finished in time. So just something to think about. I didn't want you guys to think that there wasn't a way the unit can also move that back. But you have to push it through your S1, your operations shop, and through a DA form 4187.
With my first one, I gave birth when Audrina was on vacation, and trying to breastfeed was nearly impossible because they didn't have a lactation consultant in the Italian hospital. Is that going to be changed, or if you're on a weekend, are you just fending for yourself?
We have our lactation consultant here.
There's ours.
Dr. Novak and I were talking about how can we make it possible for us to see you all. And so he would say every other day during the week, Monday, Wednesday, Friday, we should be able to see everybody. I don't know what is going to happen if you deliver on on Saturday. Knowing that on the first day babies, maybe at the first time that they come to the breast, they're pretty good, and then they sleep almost for 2 days. So we are going to try that. I don't know if we can go, how far we can go, for you to call us, because we don't even know that you gave birth. I'm sure there is the same HIPAA confidentiality issues even in San Bortolo. When you give birth at the birth pavilion, is the nursing staff or yourself will call us and say, hey, before I'm discharged, can you please come? Because when we come, if we come and visit you the first day that you deliver, you always say, no, everything's going well, no pain. Then you go home and you say, oh, it's painful. So we want to be there to help you and really be able to observe you breastfeeding. Even if you say that it's not painful, we like to do that before you go home. Because the nights are long when you go home with a new baby.
Perfect.
So this is something that is still in the work.
I can tell you that the nurses there do ask you, do you know how to breastfeed? This is my 4th child, so it's to them also, I just thought I'd make a note here, they automatically assume you're going to breastfeed. If you're not going to, you need to let them know, like immediately, if you're going to have a bottle baby, because they don't even think to ask you that for some reason. But so I was experienced when they came in and asked me if I needed help. I was good to go. But my girlfriend was not. She's from England and was also delivering there. And I just want to put out that they are not as gentle as we are naturally. We tend to make it more of a gentle process. They will just take it and shove it right in there. So be prepared, if it's the nurses there that are going to help you, to be a little maybe shocked by that.
Just a real quick, if anybody has a kid or children in the CDC, we do have your vouchers. So if you do need to leave earlier, they're right outside, and Chris Brown will hand you one. And you just need one per family. Okay, our next question is, This is from a mother who is a non-American citizen. What are the steps to do for her baby's paperwork? Are they the same as long as she's married to a soldier as an American citizen?
I'm sorry, I couldn't hear the question.
If this question is coming from a non-American citizen, what are the steps to do for her baby's paperwork? Will they be different than a mother who is? Huh. Same process.
If it's the mother's not American, or sorry, not U.S., we need 5 years physical presence in the U.S. for the father. Usually that can be done with the ERB if the soldier's been in at least 5 years or more. If not, we'll need like high school transcripts or diploma or income tax records, just something showing that he's been in the States for 5 years.
Okay.
Other than that, that's the only difference. So if he's been in like over 5 years, needs ERB or ORB, and that's fine.
Okay.
Okay. And the father's American, obviously.
Okay. Will your baby need a sojourno if we PCS 3 months after the baby is born? No. No is the answer. Who speaks up for us at San Bortolo when we are requesting things that are within reason but are culturally different to the Italian staff and are being denied or told no when American representatives have told us something else?
Yeah, again, we've kind of talked about communication and advocacy. So, again, I just ask you to have the patient liaison's phone handy. If you get into that kind of situation, call. As long as everything is medically stable, you can kind of put a hold on, hold X, if you will, and just wait until they can come up and take care of you. You certainly, there is a bit of flexibility that has to kind of occur on both sides. You don't want to ruin your birthing experience because we're so tied down to one expectation. Certainly if it's a safety issue or you just don't understand the medical care, that's obviously incredibly reasonable. But again, just call the patient liaison. They should be able to get to you as quickly as possible.
I have something to comment on that. There was something that came up during my daughter's stay, and we did take it through the liaison, and either through a miscommunication on her part to the nursing staff or something, I'm not sure what ended up happening is not what we had discussed, and it caused one of our not so nice days to happen. It was in regards to breastfeeding, and my daughter went nearly 12 or 14 hours or something like that without being breastfed or given pumped breast milk, and they gave her formula when we had expressly asked it not to happen. And so even if you do take it through a channel and you're being told it's addressed, if the reality of what happens is different from what you had discussed, don't let it just lie. If you get the impression that it is something that can still be problem solved by taking it through, and still discussing the issue, then please do that. Don't let if something happens that you weren't expecting or that is not what you consider acceptable, or not what you were made to expect to happen, then just keep pushing it. Maybe something got miscommunicated, maybe something got misunderstood, even to the English-speaking liaison. Just don't let it lie. Just keep taking it, and if you have to, speak through I'm sure the patient advocate that we have at the clinic would be a good resource for you as well, to speak up or use ICE comments. I'm sure that's a good forum still as well.
Yeah, and that's what I was going to add to that. Sometimes we don't meet expectations at the health center. That's what we have an ICE comment card system for and what we have a patient representative for. So as the commander, I'm very, very interested when we're not meeting expectations at the health center so that I can look at if there's a system or a process issue with that. And just like as things happen very specifically downtown, if those things happen, don't just take those home with you, and talk about them amongst friends. Bring those up to my attention either through an ICE comment card or through the discharge summary that we're going to do, the discharge survey, and make sure that we're aware of that, because sometimes at the tactical level, if you will, things kind of get a little bit lost, but when you bring those up a couple of levels, they can be corrected by leadership down at the health center that they weren't aware of.
Okay, this is a question about the anesthesia for birth at San Bortolo. On the tour, I was actually on this tour, and one of the women was told by the anesthesiologist at San Bortolo that they do not do a numbing shot before the actual epidural, but that he could do a cream. Is that true, or are they trying to do that shot, or?
Yeah, that's another thing I'll take back and ask for. We have that cream in the States. It's Emla cream, and you can leave it in place for 10, 15 minutes, and it kind of does the trick. Without getting too into the gory details of medicine, it may just be a technique issue that they use here that, one stick's better than two kind of thing. But I will bring that up with them, and I'll talk to Colonel Burnett and our OB staff as to how they do that at the health center and see if we can engage that with San Bortolo anesthesia staff.
Okay. I think that's all the questions I have, unless anybody has something they've thought of in the audience.
I actually have two questions. My first is, I know in the States they have a certain weight that they want the babies to be before they leave the hospital. What is that here?
I don't think so. Sometimes if you've delivered prematurely and the baby hasn't made a certain weight, they might keep you for a little while longer. But usually you expect your child to lose about 10% of weight and then gain that back by the second week. And so that's very, very normal. So I'm not tracking any specific weights that they have that you have to be before you go home. Probably just that you're feeding well and everything's looking good.
Okay, my second question is, will they let the baby go home on oxygen?
On oxygen, if your baby has an oxygen requirement, I cannot imagine they would let you go home like that. So if there were any concerns with that, if your baby was requiring oxygen, you'd probably be in the NICU for a little while until they figured out what was going on and got the baby stabilized. But yeah, I can't imagine they would send you home on oxygen. Good question.
My personal experience with that, my baby did require oxygen while she was in the hospital for the first 2 of her 5 days. She was off oxygen for a full 3 days before we left the NICU, and that was to receive some other medication. But as a nurse, and to reiterate what Colonel Barr said, because he's obviously a good authority on that, you probably don't want your baby going home on oxygen. And you can rest assured that them being in this particular medical facility, that if they have an oxygen requirement, it's going to be fully well addressed. And if you're not very familiar with how to administer all that, you don't want your baby home on oxygen anyway. So it is going to be a priority to get them off oxygen before they would leave.
Okay, do you guys have anything else you want to add or share? Or?
We've talked a lot about the things that can go wrong or the things that you should be braced for and all that. But we haven't really talked about is some of the things that they offer that are actually better than the States. That's something that we haven't really touched on much. And let me tell you, one major thing is that when seen at San Bortolo, when I first was in my prenatal care and I went to see my doctor, now having 3 children previously to this, I had certain expectations, of course. But this time, going to my appointment, usually you go in, you see a tech and they take your blood pressure, they take all these things, and then you see a lab tech and he takes some blood from you that day, and then maybe you go and get an ultrasound done with an ultrasound tech, and then you sit down with the midwife and you discuss everything that's going on with you then. And then at some point you get to see the doctor. This time, the doctor is all-inclusive. From start to finish at your appointment, every single thing that is done by that doctor. So you see the same person. He knows every single facet of your care, even right down to having your blood drawn. The ultrasounds that they do, to this point in my life, it's always been the same. You have 2 or 3 ultrasounds in your pregnancy, and it's a matter of, okay, all the parts are there, it's a boy, it's a girl, bye. This time it was done so thoroughly that we truly knew every single speck of my son before we ever even got to hold him. I mean, I've never, in 4 children, and let me tell you, my children range from 20 years to 4 months, so we got a lot going on there. I've never had the quality of care that I had at San Bortolo. It was truly, out of all 4 experiences, the best one that I have ever had. Yes, there's some things that you can look back on and you can laugh about afterwards, of course, but truly, they are dedicated to making sure that this is a great experience for you and for them also. And besides the all-inclusive care there's another thing. From the second you walk in, you get your own midwife. She doesn't leave you. If you've ever had a child in the States, they're in one room, they come in, they come check on you, they leave, they go back, it's a constant thing. If you need something, you have to wait for them to come back. Here, the second that you are checked in, you have someone that is by your side the whole time that never leaves your room. So that's an incredibly impressive thing if you've never had that. And The main thing is that you also get to choose your level of epidural care, you know, from 0 to 10. I wanted 10, and you guys might want to feel a little more than me. I don't know. She didn't speak very good English, but she had a phone on her the whole time, and anytime if I had something that I couldn't convey to her, she called the liaison. And even though the liaison maybe couldn't come down to the birthing room at that moment, it was right there on the phone the whole time. And of course, I had my mother and my husband in there to yell at, so, I mean, I could talk to them if I needed to, and they could leave the room and deal with any issues that I may have.
My midwife didn't speak English either, but the liaison didn't leave from the time that I got there. I called ahead and said, I'm coming, I'm in labor, and they said, oh great, come to the liaison's office, you know where we're at? And I said, yes, I do, and I think they probably think, oh, an American girl's in labor, she's probably like 2 centimeters or something, come to the liaison's office, and I showed up, and I was in labor. So we went straight to the labor and delivery ward, and she stayed with me literally from the time that I got there until the whole 2 hours after my son was born. I was concerned about them taking him away because I heard all the horror stories too, like he's born, they take him away, where does he go, I don't know. So I told her that I didn't want him to leave, and she said, okay, we're not going to take him, and she stayed, and she wasn't a nuisance at all, but she didn't leave the entire time. So there was no sort of miscommunications at all. Granted, it wasn't a 12-hour process, but she was able to stay the entire time.
Just personally, I would just like to thank all of you for your resiliency and your flexibility in all this. This is a huge change for our community, both from my side but also from your side. And so again, as we've talked about communication, I just ask you to prepare for things that might not meet expectations, but I think most of them will. And then just make sure that we're communicating after each of these deliveries so that we can continue to make things the best we can for our entire community. But we'll be there with you, so you're not alone.
Okay, well, that concludes the formal part of the baby brief. You all are welcome to stay and chit-chat with one another or some of our vendors who are still here. Thank you guys so much for coming. You were amazing and provided really good information. And also, thank you all for coming.